Finding the right TPA dose for patients with acute ischemic stroke. What is TPA? TPA is a protein involved in the breakdown of blood clots. It's found on endothelial cells that line the blood vessels. As an enzyme, it catalyzes the conversion of plasminogen to plasmin.
Activase, also known as recombinant tissue plasminogen activator, or TPA, is the only drug approved by the FDA for treatment of stroke. Growing plaque can rupture, promoting thrombus formation by activating the coagulation cascade. Platelets and red blood cells aggregate at the site of injury, causing further narrowing of the artery. This impedes blood flow even more and causes turbulence in the artery. It also increases the likelihood of thrombus formation. As the thrombus grows, it causes increased vessel narrowing, leading to partial or even complete occlusion. The occluded artery leads to ischemia and tissue necrosis. When a piece of thrombus breaks off, it's called an embolus as it travels up the artery. During a stroke, ischemia can progress to infarction. Beyond the infarction lies still viable tissue called the penumbra. Cells within the penumbra are potentially salvageable if blood flow and vital oxygen are restored promptly. The penumbra is the focus of fibrinolytic treatment. Now let's look at the thrombus itself. Inside the thrombus are strands of fibrin, the protein that forms a clot. Enmeshed within the fibrin is plasminogen, the inactive precursor of plasmin. Activase is administered by IV infusion within 3 hours of acute ischemic stroke symptom onset. Activase binds to the fibrin in a thrombus and converts plasminogen to plasmin. Plasmin then breaks the strands of fibrin and dissolves the clot. As the clot dissolves, blood flow is restored, and viable tissue may be reperfused. Although the original infarction remains, when surrounding cells in the penumbra are saved or reperfused, function may be restored. Activase, the one TPA for stroke, is the only drug approved by the FDA for this indication. Activase is indicated for the management of acute ischemic stroke in adults for improving neurological recovery and reducing the incidence of disability. Treatment should only be initiated within 3 hours after the onset of stroke symptoms and after exclusion of intracranial hemorrhage by a cranial computerized tomography, CT scan, or other diagnostic imaging method sensitive for the presence of hemorrhage. See contraindications in the full prescribing information. All thrombolytic agents increase the risk of bleeding, including intracranial bleeding, and should be used only in appropriate patients. Not all patients with acute ischemic stroke will be eligible for Activase therapy, including patients with evidence of recent or active bleeding, recent within 3 months intracranial or intraspinal surgery, serious head trauma, or previous stroke, uncontrolled high blood pressure, or impaired blood clotting. For further information, please refer to the full prescribing information accompanying this video animation.
Dose. The standard dose is 0.9 milligrams per kilogram of body weight, maximum 90 milligrams. Application in medicine. TPA is used in some cases of disease that present blood clots, such as pulmonary embolisms, myocardial infarctions, and stroke, in a medical treatment called thrombolysis. The most common use is for ischemic stroke. Pros and cons. Pros. Patients that receive TPA have better outcomes after an ischemic stroke. Cons. The principal cons of TPA is that cause hemorrhage in some patients, especially hemorrhagic stroke. Another complication is that some patients could have allergic reactions, nausea, vomit, and fever. Issue applied in Ecuador. In 2016, the Pontificia Universidad Católica del Ecuador presented an investigation about TPA in which it refers that the group of patients with acute transient ischemic disease who received oral antiplatelet therapy had a higher degree of disability measured with the modified ranking scale at discharge, compared with the group that received alteplase, which in average was low. Conclusion. TPA is the main treatment for ischemic stroke because patients have better results after using them, but the main disadvantages are that they can develop hemorrhagic episodes.